Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Sajal just wrote in and said, hi, I'm from India. Also want to say that we have Holland in the house. Anada said she's from Holland. But Saja says they're using skills, have been using skills for a long time. Just wanted to know, what does a typical day in a 25 to 40 hour ABA look like for a verbal child, level 3 VB map, 5 years of age? That's a ginormous question.
Yeah, so it's going to be, I'm just going to tell you the typical kind of ABA schedule. And I think they said 30 hours a week. Did they say the total number of hours, Shannon?
They said 25 to 40.
25. Yeah. Well, so, if you're 25 hours a week, we're looking at 5 hours a day or so. Probably it's a 5-year-old. So they're probably, and depending on where you are in the world, they're starting school soon. And if they start school, then you want to try to spread the hours over 7 days, because you definitely want to capture the weekend and not let the child have nothing to do on the weekend. The weekend is very, very important, because I suggest that the weekends be split up so that every day, Saturday and Sunday, or whatever weekend you may have, depending on where you are in the world, you spend half of the day kind of doing social activity with the family and half of the day doing ABA. So that would give you the ability to, let's say, do at least 4 hours on each of ABA on each day of the weekend. So that's about 8 hours right there. And then the rest of the hours, let's say you're doing a total of, 30, and you have like now 22 hours left. You divide it amongst the rest of the 5 days, and you are hopefully, if you're still out of school, you would be doing that kind of in 2-hour blocks. This is a 5-year-old. So you would be doing this in 2-hour blocks throughout the day. If it's a child who's already in school, it becomes a little bit harder, and you want to try to fill his afternoon and evening, right? And the sessions are generally, I don't like to have sessions that are longer than 2 hours. I will do up to 4-hour sessions depending on the child, because sometimes either the activity is very long or like, for instance, when it's let's say we're looking at a 9-year-old and we're teaching social skills. So all we're focused on is having play dates. Then the activity is probably going to be more like 4 hours, because we want to have interaction with other kids who come over, etc. But a 2-hour session so you'll have, let's say, multiple 2-hour sessions, right? With different people, hopefully. So you can have one therapist from, let's say, 10 to 12, then the child has a break for an hour, and then you'll have another session from 1 to 3, and then the child has a break, and then you have another session, that kind of thing. And I don't think you should be doing more than about 6 hours a day. That's a lot already. So, spread it out. But inside the 2-hour session, there's basically a ton of breaks. And the way that it works is that you would do, within a 2-hour session, you'd probably be, depends on the child again, you'd probably be working on somewhere between 10 and 15 different lessons. And each lesson you'll do in segments. So you'll do, let's say, 2 to 3 minutes of a particular lesson, and then a minute of something rewarding like play or just free time. Then you do another, let's say, 3 minutes of perhaps the same lesson, so that you get a few repetitions of each lesson, and then you will move on to a different lesson. And you want to alternate the lessons, because some lessons our kids are going to be better at, so they'll get more reward. You want to alternate the lessons because you don't want the child sitting at all times. So some lessons require the child to get up and move around. So that helps break things up. The reason that you want multiple people doing this stuff is because it helps the child generalize, so that they're not just behaving really well with one child, they're responding to with one therapist, they're responding to multiple people. And then of course you also are breaking down your lessons. Some of them are brand new lessons that are active and you're working on them. Some of them are maintenance, so lessons that have already been learned, but we're just kind of checking in to make sure they're maintained. And then some lessons are in generalization mode. That means they've been learned in the sit down type of modality, but now you're moving around the house, moving around the school, moving around community, and you're trying to make sure this particular skill is still functional in outside of the sit down one-to-one environment. So you're generalizing to real life. So there's a lot that goes into it, but it's like, just make sure that it's not rote and repetitious. There's got to be a ton of reinforcement and like fun activities for the child, and in order to remain engaged.
There we go. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.